teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini. Membuat pelayanan publik menjadi kacau. Akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau. Akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau. Akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau. Akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau. Akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, untuk memutus mata rantai korupsi dan gratifikasi, jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau, akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi, karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau. Akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai korupsi dan gratifikasi. Jadilah pahlawan integritas dan hapuskan diskriminasi akibat korupsi. Berjuang untuk bebas dari korupsi dan gratifikasi. Karena bangsa merdeka adalah bangsa yang adil dan sejahtera. Wujudkan Indonesia merdeka tanpa korupsi dan gratifikasi. Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang dapat merusak bangsa ini? Membuat pelayanan publik menjadi kacau. Akses pendidikan yang tidak merata, merusak iklim investasi dan menyebabkan ekonomi biaya tinggi. Menyebabkan diskriminasi dalam berkarir dan sulitnya mengejar prestasi di kancah dunia. Karena itu, mari kita semua bersatu untuk memutus mata rantai.
Selamat pagi, Ibu Direktur, Bapak Ibu Pimpinan. Mohon izin menunggu sebentar, Ibu, karena kami masih menghubungi narasumber. Beliau nampaknya belum join, Ibu.
Ya, Bu Kajun, sudah bisa dikontak narsumnya?
Sudah, Ibu. Beliaunya bilang oke, tapi belum join, Ibu.
Linknya sudah betul ya?
Sudah, Bu.
Apakah teman-teman tahu, korupsi dan gratifikasi adalah permasalahan serius yang
Attention please, the event will be start. Good morning. Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom Nama Budaya. Greeting to all of us. Good morning and welcome to all attendees who can attend this event. The Honorable Director of Poltekkes Kemenkes Denpasar, whom we respect. Today's guest lecture speakers is Dr. Vilma Ajijuljana, Vice Director, the Poltekkes Kemenkes Denpasar, Head of Academic Administration, Subdivision and Head of General Administration, Poltekkes Kemenkes Denpasar, Chairman of SPI at the Poltekkes Kemenkes Denpasar, Head of Center in the Poltekkes Kemenkes Denpasar, Head of Department in the Poltekkes Kemenkes Denpasar, Secretary in Midwifery Department Poltekkes Kemenkes Denpasar, Head of Applied Undergraduate Program Study of Midwifery Department Poltekkes Kemenkes Denpasar, Head of Diploma Study Program 3 of Midwifery Department Poltekkes Kemenkes Denpasar, lecturers and staff of Midwifery Department Poltekkes Kemenkes Denpasar, and all online attendees. We offer thanks to God Almighty because with God's blessing, we can get gather online in the update guest lecture on cancer, prevention, and management in women. Let me introduce myself, Putri Citra, as the Master of Ceremony, who will guide today's event from start to finish. Distinguished guests, before the event begins, allow me to read the series of events today. The first is opening, singing the Indonesian national anthem, prayer, speech from the head of Midwifery Department of Poltekkes Kemenkes Denpasar, speech from the Director Poltekkes Kemenkes Denpasar, who will also officially open today's events. Reading the moderator CV, presentation of material by the speaker, discussion session, submission session of certificate, documentation session, and the last is closing. The attendance. Before we starting the event, I remind you all participants of the guest lecture to fill in the attendance link that been sent by commit to the participant group at Zoom meeting and YouTube live streaming. For all participants, please turn on the camera. the attendance. Before we start today's event, let's pray together to our respective religions' belief. Pray begin. Pray finish. The next event is speech from Head of Midwifery Department of Poltekkes Kemenkes Denpasar to Mrs. 𝐊𝐿𝐄𝐻 𝐿𝐄𝐻𝐿 SSTM Biomed. The time and place are welcome.
Thank you, Putri Citra. Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Selamat pagi semuanya. The Honorable Director of Poltekkes Kemenkes Denpasar, Ibu Dr. Sri Rahayu S.Tr 𝐻𝐿𝐄𝐻𝐡 M.Kes. Honorable, the guest speaker, Ibu Dr. Filma Aji Juljana from MSU Malaysia. Thank you for accepting our invitation. Good morning, Ibu. Semoga sudah join. Honorable, all leaders, lecturers, and all participants, thank you for joining. The title of the guest lecture event is Prevention and Management of Cancer in Women Update. And the purpose of this event is to provide students with additional knowledge related to cancer disease. The participants are all midwifery students from Poltekkes Kemenkes Denpasar, including students from the Diploma 3 midwifery program, Bachelor of Applied Science in Midwifery, and midwifery profession program. To all students, I hope there will be lots of questions about cancer. Jadi kepada mahasiswa, saya persilakan nanti bertanya sebanyak mungkin terkait dengan pencegahan penyakit kanker kepada narasumber. Finally, I would like to invite Ibu Direktur untuk berkenan memberikan sambutan dan membuka acara secara resmi. Maybe that's all, and thank you for your attention. Om Santi 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 Om. Good morning.
Thank you to the Head of Midwifery Department of the Poltekkes Kemenkes Denpasar for giving your speech and inspiring word. The next event is speech from Director of Poltekkes Kemenkes Denpasar, as well as opening the event this morning to Mrs. Dr. Sri Rahayu S.Kep Nurse M.Kes. The time and place are welcome.
Okay, thank you. My voice is clear?
Clear,
Hello?
Ibu. Clear,
Okay,
Ibu.
yeah, okay. Yeah. Selamat pagi, good morning everyone. Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Salam namo buddhaya, salam sehat, salam kebajikan untuk kita semuanya.
Mereka berproses yang
The honorable speaker on this lecture, Ibu Dr. Filma Aji Juljana. Selamat pagi, Bu Filma. Ibu can join us this agenda today. Manager at Poltekkes Kemenkes Denpasar, Vice Director, Head of Internal Monitoring Unit, Head of Academic Administration Subdivision and General Administration Subdivision, Head of Department in Poltekkes Kemenkes Denpasar, Head of Center Unit, Secretary of Midwifery Department, Head of Diploma 3 Midwifery, Applied Bachelor and Associate Degree of Midwifery Study Program, lecturer and staff, and for all students. Bapak Ibu, first of all, I would like to appreciate Midwifery Department for holding this event to improve skill in prevent and promoting in cancer cases. And we would like to extend our heartfelt appreciation to all the participants. Further, our gratitude to both the invitees and attendees who have brought immense joy and pride to our event. First of all, let us offer praise to gratitude to the presence of God Almighty, who always gives His mercy and grace to all of us, so that on this occasion we can hold guest lecture with tema Prevention and Management of Cancer in Women Update. We would like to thank the invited guests who have agreed to attend, as well as the committee who have prepared this morning activities so that our agenda today may run smoothly. We know cancer in women include different types of cancer that can affect the reproductive system and other organs. Based on the data from the Indonesia Health Profile, cancer in women in Indonesia is dominated by two types of cancer, breast cancer and cervical cancer. Midwifery Department of Poltekkes Kemenkes Denpasar contribution to reducing the incidence of cancer is to become a health education institution for cancer center of excellence. So Poltekkes Kemenkes Denpasar prepared its students to have competence, especially in preventive and promotive of cancer. So which educate prospective midwife need to prepare the competency of students to be ready, provide and treatment in women. Therefore, guest lecture activities are one of the effort to improve the competency of midwife in cancer and care. Once again, I heartfelt welcome to Ibu Dr. Vilma that present here today. Finally, I would like to thank all parties and we apologize if there was anything unpleasant in the delivery to the speak. Before close my speak, let me say one pantun in Indonesia. Pergi ke pasar membeli pandan, cakep. Jangan lupa membeli kue cucur.
Cakep.
Bagi seluruh mahasiswa kebidanan, selamat mengikuti guest lecture. Thank you, selamat pagi. Assalamualaikum warahmatullahi wabarakatuh. Om Santi, Santi, Santi Om.
Thank you to the Director of Poltekkes Kemenkes Denpasar for your giving your speech and inspiring words. The next event is presentation of material by the speaker. Distinguished guests, this guest lecture will present very interesting material. This session will be led by moderator. Before that, allow me to explain CV of moderator. She is Mrs. Bidani Madedwi Mahayati, S.Tr. M.Keb. She is lecturer in Midwifery Department of Poltekkes Kemenkes Denpasar. To Mrs. Bidani Madedwi Mahayati, S.Tr. M.Keb, the time and place are welcome.
Okay, thank you, MC, for the time that's given to me. Good mornings, all. I'm audible? Is my voice clear?
Clear.
Okay, thank you. Okay, good mornings, everyone. Thank you for joining with us today for this special guest lecture. We are truly honored to have an esteemed expert in cancer prevention and management with us today. The Honorable Director of Poltekkes Kemenkes Denpasar, our speaker, Dr. Vilma Juliana, Vice Director, and to all the management in Poltekkes Kemenkes Denpasar, all lecturer, and all the participants. Please allow me, Dwi Mahayati, as your moderator for this special guest lecture today. It is my pleasure to introduce you Dr. Vilma, Our speaker is a leading specialist from MSU. Dr. Filma has extensive experiences in oncology and has contributed significantly to advancement in cancer research, prevention, and treatments. Today, she will share valuable insights on the latest updates in cancer prevention and management, a topic that is very crucial for all as a healthcare professionals. Before we begin, I would like to remind to everyone to kindly mute their microphones during the presentations, and they will have a question and answer sessions at the end after the presentations. So please save your question for then, or feel free to type them in the chat, and we will address the question after the talks. Okay, without further ado, please join me in welcoming Dr. Filma Jurusan. Good morning, Dr. Filma.
Right, good morning and
Halo. Ya, selamat pagi. Good morning, Dr. Filma. Halo. Halo, Dr. Filma, can you hear me?
yes, thank you for having me. Is my voice clear?
Yes, clear. Okay, good morning, Dr. Filma. Thank you for joining with us today. It's very pleasure to have you with us. Before you start the presentation, I will read a short brief of your curriculum vitae. Okay, to all the participants, our speaker today is Dr. Filma Jurusan, PhD Man, BSN RN. For her education is PhD in Nursing, Master of Arts in Nursing. Before has graduated from the Bachelor of Science in Nursing Philippines, 𝐊𝐔𝐃𝐽 or Geriatric Nursing, and also graduate certified in nursing education for teaching methodology, University of South Australia, Adelaide, Australia. So for her professional summary, so she is a speaker and also presenter for many workshops and also conference. Also be a reviewer board in a journal Malahayati International Journal of Nursing and Health Sciences. Also as the research committee member, and also participate and develop curriculum for nursing and midwifery courses, develop gerontology, geriatric nursing curriculum, deliver higher level undergraduate and graduate courses via classroom, and so many professional summary that Dr. Filma has done. Okay, next. Okay. I think enough. Okay, for the employment history, she is now a senior lecturer in Management and Science University in MSU, Malaysia, from 2022 until present. Before that, she also as a lecturer in different university and also as a staff nurse in some hospital in Philippines and then in Saudi Arabia. So many experience that Dr. Filma has done. Thank you for joining us today, Dr. Filma. I think it's enough for her curriculum vitae. So now we are going to go to the presentation of Dr. Filma. Committee, please tap the share screen. Okay.
Okay.
Dr. Filma, yes, your time is about
Yeah.
19 minutes. After the presentation, that we will have the question and answer session about 30 minutes. Are you ready, Dr. Filma?
Yeah, inshallah. Okay, do I
Okay.
have to share my presentation or because I think our GA already given to you the presentation?
Yes, the material, your PowerPoint already with us. Do you want from us to share screen?
Okay, I will try mine because there's something okay, I will try to
Different.
share.
Okay. If you need help, we can help you.
Yeah.
Please. Okay.
Okay, is it okay? Can we see in
Not
the
yet.
screen?
Okay. Yes, we can see.
Can see, right? All right.
Yes.
So can we start? How many minutes is 30 minutes, right?
19 minutes. for the presentation,
Oh,
about
okay. So we
90
have to be,
minutes.
yeah, we
Yes,
have to be very fast. All right.
19
So,
19 minutes, and then we will have a discussion about 30 minutes.
all right. Okay.
Okay.
So we will.
Okay, time is
I will
yours.
just. Yeah.
Yes.
Okay. Good morning, everyone, and assalamualaikum to all participants in this. Is it a conference or online conference? Yeah. Okay.
This is yes.
Yeah. Okay. So my topic today is a prevention and management of cancer in women, the updates. All right. So I will just go through in brief. Okay. So the incidence of cancers, especially in women nowadays, is actually is very sad. But we have to accept it. It is true that an average of 4 million women died each year because of cancer, and it has been the trend is increasing as years go by. Okay, I'm going to show to you the graph, just a bit of a graph reported by World Health Organization in 2022. Yeah, because we don't have yet the report of 2024. Okay, so
I'm
this is the
sorry,
new
Dr.
cases.
Filma. Dr. Filma,
Yeah.
I'm sorry, interrupted you. Please, would you like to the slide is not slideshow?
Oh, okay. Can you just show there, because I don't think I can. Okay, like that. Can.
Yes, yes, great. Thank you, Dr. Filma.
Okay. So as what I've said, the average of women, the incidence, that is only the incidence. We're not yet talking of, I mean, the women died of cancer for, the average women died of cancer is about more or less 4 million yearly. Okay, and as reported by World Health Organization, this is the new trend. Okay, there has been a new cases worldwide in 2022 is about 20 million, and out of the 20 million, one of the highest numbers of cancer is in women, particularly breast cancer, right, and other cancers of reproductive organs. That is both sexes. Right, now let's go to the, sorry, why my slide is not Dewey. I
Yes,
cannot change the
yes.
slide.
Oh, or do you want us to help to present the presentation?
Can
Okay. Okay, yes, we can. Please, the committee, adik-adik panitia, tolong dibantu untuk share screen. Maybe Dr. Filma can stop share screen first,
okay.
so that our committee will help you to
All
share
right,
screen
okay,
from
okay.
here. Yes.
How to stop? Okay, wait.
Sambil menunggu, while waiting for the committee, please prepare to present our speaker presentation. Thank you.
Oh, I guess the moving already. Sorry. Boleh nampak kot. Sorry lah for this. I'm very sorry for this.
Yes, it's okay, Dr. Filma.
Okay. So the number of women, again, is not. Is it my internet or? Okay, stop
But we
share.
can.
I stop
Okay.
share. Okay, can you share my slide, please?
Okay. Okay. The committee, please share the presentation from Dr. Filma.
All right. Now, can you go to the next slide?
Next slide.
Okay, so this is the average women new cases of cancer in 2022 as reported by World Health Organization. We have more or less about 9 million, more than 9 million women suffered from cancer. And as you can see in the graph, the highest percentage is again in the reproductive organs. Number one is the breast cancer, right? So that is the new cases. Let's go to the next slide, please. Okay, now the mortality rate. Women died of cancer in 2022 worldwide is about 4 million. More than 4 million women died of a cancer. And again, the highest percentage is in the reproductive organs, especially in breast cancer. The next one is the lung cancer. And we have also cervical and uterine cancer here. And the rest of about 42% of this, more than 4 million, is other types of cancers. Okay, so that is, what about in Southeast Asia? When I talk about Southeast Asian nations, it includes Indonesia, Philippines, Thailand, Myanmar. Okay, go to my next slide, please. All right, so this is the Southeast Asian region mortality rate of female cancer, right? So again, the highest average of mortality rate women died of cancer is breast cancer in Southeast Asian nations. And the second one, highest percentage of cancer in women in Southeast Asian nations is cervical or uterine cancer, which is again in the reproductive organs, and ovarian cancer, and the rest of cancers. Okay, next, please. Okay, so this is the rankings of a number of cancers, okay, worldwide. So you can see the number 2 here. Okay, can you need the next button so that I add the animation there. Breast cancer is number 2. Then and also you can see here at number 8 is the cervical or uterine cancers. So number 2 again is the breast cancer, meaning that the incidence of new cases and mortality rate of breast cancer is actually increasing. Okay, next slide, please. Yeah, yes, number 2 breast cancer, and at number 8 is again cervical and uterine cancer. Next, please. Okay, so in Southeast Asian nations, we have here, what can you see in the graph? You are the highest percentage among Southeast Asian nations because Indian is an Asia. We are Southeast Asian nations. So in Southeast Asian nations, Indonesia is the highest percentage of new cases of breast cancer. Indonesia. What about cervical cancer? Next, please. Oh, ovarian cancer, also Indonesia is the highest among the Southeast Asian nations. Okay, Thailand is the second, while in the Asia part, India is very much higher in incidence rate. Okay, cervical cancer next. So cervical or uterine cancer again in Pacific side, Asia, India again is the highest percentage of the numbers of incidents of cervical or uterine cancers, and Indonesia on the part of Southeast Asian nations. So about there has been an incidence of 195,000. More than 995,000 in Southeast Asian nations reported in year 2022. And among the group of Southeast Asian nations, Indonesia has the highest number of new cases. Okay, next, please. Okay, so for the most common cancer site in female all over the world, You can see the pink color there that is all over the world. You can see down here, all right, the most common cancer site, bladder, and again, breast cancer, cervical, and or uterine cancers, and other types of cancers in women. That is in women, all right? Okay, next slide, please. Okay, so what is actually cancer and how it happens? Okay, cancer is a group of diseases characterized by uncontrolled growth. If there is uncontrolled growth of and spread of abnormal cells, and it has the ability to invade adjacent or near tissues. And when I talk of tissues, organs, okay, because organs made of tissues. So it can invade adjacent tissues and distant organs as well. Okay, it depends on which part of the cancer cell is which has a rate of facilitating, no, or the proliferative rate is higher in different parts of the cancer cells that it grows in different organs. Okay, and if the spread is not controlled, it can result in death. Now, there is no specific causes of cancer. Until now, the scientists still studying what would be the specific, because if we know the specific cause, the treatment would be easy. Okay, and it has only risk factors, because according to the scientific research studies, people who have cancer are more or less the highest percentage of having those who are suffering from cancers are actually smokers, okay, or consume tobacco, and having infectious organisms are also one of the causative risk factors. And if you are having unhealthy diet and unhealthy lifestyles, why? Because when you have unhealthy diet or unhealthy lifestyles, you have a sedentary lifestyle, you're not moving, you're not exercising, and your diet, your nutritional intake, you're not controlling it, the tendency is it will lead to obesity. Now, what obesity can do to cancer? It has a linkage. According to scientific research, obesity has a link to cancer, because when a person is obese, his fat cells will produce the so-called hormones, which is leptin. The leptin hormone can release in the fat cells of a person who is obese. And this leptin hormone can damage the cell, can lead to the growth of cancer cell, because it's proliferate. It will multiply abnormally. Now, multiplications of cell abnormally, it leads to abnormal numbers of cells, which will group into one and damage other cells because of suppression there, and it can lead to cancer growth. Okay, abnormal growth of the cells, which can lead to cancer. Therefore, obesity has a significant association to cancer. Although, because our body also has a hormone, our adipose tissue will normally produce the so-called adenopectin hormone. Adenopectin hormone actually can help. It has an anti-cancer cell. No, it will actually fight the cancer cells. But if you are obese, okay, this adenopectin hormone will be reduced in number, because it will be replaced by leptin in the fat cells. So leptin can damage, can proliferate abnormally. Significantly, it will multiply the cell divisions, and it can lead to mutations of cell. When I said mutation, meaning it will lead to cell the cell shape, the pathway of the cell will be damaged, and the shape of the cell will not be a normal one, which will lead to damaged cell, and accumulation of these mutated cells will lead to cancer growth. Therefore, that's why obesity has a link to cancer. All right. Now, a family history. If you have a family history of cancer, any type of cancer, you will have the genes, the so-called BRCA1 and BRCA2. These two genes actually can suppress tumors. But if it is, you have a cancer cells, these two cells, instead of suppressing tumor, it can mutate the DNA. Now, mutations of the DNA in the cell can have a space for abnormal growth, which can lead to cancer. So these are only the factors. There's no specific causes, as what I've said, but most of the scientific study of people who have cancer has these causative risk factors. And we have the internal factors such as inherited genetic mutations. Okay, genetic mutations, as what I've said earlier, the BRCA1 and BRCA2. This is a genes present in egg cell and sperm cell, which is passed on to the next generations. Therefore, if you have family history of genes that has cancer, then these genes will be mutated and it can pass to you. All right. Okay, next, please. Let's very fast. So this is how the abnormal cell mutation occurs. Even during the embryonic development during pregnancy, there is the so-called mosaic mutations in mothers. Now, this is abnormal actually, but it cannot be detected when the child is born. But in later years, these mosaic mutations during embryonic development can lead to cancer growth. Okay, next, please. You have to be very fast. Okay, so you can see the normal cell, all right, and the mutated cell, it has undergone two third mutations. Okay, the first mutation, you can see that the normal cell shape is damaged. Okay, and you can see the second mutations there also damaged, and it can lead to the third mutations, which is more damage. And these mutated damaged cells will be grouped into one that leads to cancer cell. All right, next, please. So human papilloma virus, HPV, is also one of the factors that can lead to cancer. All right. Kenapa tak keluar? Okay, please. All right. Okay. Okay, HPV is the necessary cause of cervical cancer and breast cancer as well. Now, what is actually human papilloma virus? It is an infectious virus that actually affects the mucous membrane and skin, and it can be transmitted to sexual intercourse. However, it can also be transmitted through oral contact and skin-to-skin contact. Okay, now there are two risk factors here, two types of HPV. We have HPV low risk, which is, you can see on the right side of the screen, HPV 6, HPV 11. This is a low risk HPV, which can cause benign cancer. HPV 16 and 18, this is the high risk that can cause malignant cancer. All right, so HPV is one of the causes of cancer. And next slide, please. Okay, so 75% of cervical cancer is caused by HPV 16 and 18, and also vaginal and vulvar cancer is also caused by this HPV. And you got on the right side of the screen, the HPV 6 and HPV 7. Also, can cause abnormal growth, but it's benign. It can be cured. All right. Okay, next, please. Next. Okay, so acute incident of HPV infections, 5 to 10 years to develop cancer from time of infection. So when you get infected, all right, it can only lead to cancer. It can only be detected and lead to cancer after 5 to 10 years. Okay. So infected only the epithelial cells, which can cause mouth cancer, esophagus cancer, and breast and cervical cancers and vulva cancers, because this is where epithelial cells is actually located. Okay, next, please. You have to be very fast. Okay, so how SPB infection occur? I already explained just now. Okay, through sexual intercourse, vertical transmission, mother to child, right? During pregnancy, it is found that in every 10 women, okay, 8 women might have SBB infection at any time in our lives. So how can we control this? How can we prevent this? Okay, next slide, please. Okay, there are types of cancer: the epithelial, the mesodermal, or the myeloma and leukemia, which is called carcinoma, sarcoma, and lymphomas. These are the 3 types of cancer. Okay, next, please. Next slide. Okay, so just now I explained about the stages of tumor progression, how the tumor or abnormal growth progress. So you can see here in the screen the normal cell, and when the cell undergoes abnormal multiplications brought about by abnormal mutations, it will change the shape and the arrangements, the organizations of cells that leads to damage of the cells. Accumulation of the damaged cells will lead to cancer. All right? Okay, next, please. Okay, what are the signs and symptoms of cancer? Just now I was talking about SPB. It will be here how to control or prevent HPV infections. We have a vaccines on that. Okay, I will talk about that later. Okay, please. Next slide. Okay, for breast cancer, there are 8 warning signs and symptoms of female breast cancer. So lump in the breast or armpit. Okay, armpit, you can find lymph nodes inflammation, which is a sign that you have a breast abnormal breast tumor or growth. And nipple discharge, abnormal discharges from the nipple. It can be blood. Changes in breast appearance. Okay, when you look at the mirror, there is abnormality in the shape of your breast. And then itchy, gatal-gatal, itchy on the breast. And then there is a red or swollen breast, and pain in the breast or chest area. And of course, there is your nipple becomes sensitive. All right. So that is a signs, warning signs of breast cancer. Next. Okay, so cervical and uterine cancer symptoms. These are the symptoms of cervical and uterine cancers. Continuous vaginal discharges. In spite of treatment, you still have those abnormal discharges that you even yourself wonder, why am I having discharges? Okay. Foul smelling, and the smell is not so good. Thick discharges, repeated vaginitis, infections of the vagina, and UTI, repeated UTI, and postcoital bleeding. Postcoital bleeding is for those reproductive women. Okay, after intercourse with your husband, you feel a pain. Okay, severe pain. They call it postcoital bleeding, and there is a bleeding after that. That is one of the warning signs also of cervical or uterine cancers in women. Okay, and if you have a non-healing or recurrent cervical erosions, there is erosions a little bit bukan laceration, erosions, abnormal erosions in the part of your cervix. Irregular or intermenstrual bleeding, especially in those premenopausal phase. When we say premenopausal phase, this is a woman whereby already in the stage of menopausal syndrome. 48, late 40s, 48, 49, because there are women who will menopause at an early stage of their life. Like me, I was menopause at the age of 49 years old. Now I'm 52. Okay, next, please. So what are the symptoms of endometrial cancer symptoms? So these are the symptoms: non-menstrual bleeding or discharges, postmenopausal bleeding, heavy bleeding, dysuria, okay, and pain during intercourse. Again, just like cervical pain and or mass in the pelvic area, you can feel it. Weight loss, abnormal weight loss, and back pain. Okay, so if you have these symptoms in your body, you have to consult the doctor. Go immediately to the doctor and do the screening, because early detections will lead to the highest percentage of survival rate. Okay, next, please. So, can cancer be prevented? Can we prevent cancer? So, in the screen, I'm showing to you what the physician can see during our consultations. They can see there is a behavioral risk factors like, obesity, metabolic risk factors, chronic illnesses, non-communicable diseases, and they fail to see that tobacco use, an unhealthy diet, or physical inactivity, and the use of harmful alcohol can be the causative factor of cancer. So they can only say, okay, you have obese, you have these chronic diseases, but they failed actually to see that these obesity also cannot just cause chronic illnesses, metabolic syndromes. When I say metabolic syndromes, we're talking about hypertension, heart disease, insulin resistance, and all of those diseases. It cannot just cause that, but it can lead to cancer. As what I've said earlier, obesity can release, because obese people, they have the fat cells. The fat cells is banyak, all right? And their fat cells can releases a significant amount of leptin hormones. This leptin hormones is the one, okay, that can lead to cancer. Therefore, the doctor failed to see that, okay, that obesity cannot just affect your heart. We are always they're always looking at the heart sense of perceptions, but they cannot. But they did not link it actually to cancer. Okay, next, please. So women should take charge of their health. So if you have these symptoms, if you have these common symptoms I showed earlier, you have to consult your doctor. And if you have a family medical history of cancer, you might have that 2 genes that can cause cancer growth. BRCA1, BRCA2 can cause mutations. Then, therefore, you have to undergo screening test, right? Educating themselves on health issues. You have to educate yourself. What are the signs and symptoms? How am I going to get this? What should I do to prevent this from prevent myself from cancer, or to detect any abnormal growth in my body? And paying attention to their bodies, paying attention to different changes in your body, abrupt changes, like, for example, continuous loss of weight. It can be one of the symptoms of cancer. All right, next, please. Okay, so let's go to the prevention and management into one. Okay, so modifications of risk factors, modify, change yourself. If you are immobile, you are not moving, you don't have physical activity, you have to exercise, because exercise can boost your immune system. And when your immune system is boosted, you are free. You are protected from any infections, including the HPV infections that can cause cancer. All right? So if you are having unhealthy diet, makan macam apa-apa saja you makan, then you have to control. Okay? You have to change, modify your diet into healthy diet in order to prevent obesity that can get you into the risk of having cancer. All right. The secondary preventions, early detections, and diagnosis of common symptoms. If you have the symptoms, you go for a screening test, because early detection can lead to early management. Early management can lead to, according to the World Health Organizations, early detection of cancer can have at least increase the survival rate of at least 20%. All right. Now, the tertiary prevention is strengthening of the existing institutions of comprehensive therapy, including palliative care. This is when the patient is already having cancer, and we must have a center specifically on palliative care. All right, next, please. So, women's wellness. Next, please. Okay. So, you know what wellness is all about. It is just the absence of disease. Wellness is about the harmony of body and mind. Harmony meaning the harmony of your mind and mind, when your your body and your mind is relaxes. There's no stress. How to relax it? Exercise. All right. There has been a scientific research whereby at least you must have an exercise about 150 minutes per week. How are you going to divide 150 minutes exercise per week in order to prevent metabolic syndromes, in order to prevent cancer? 30 minutes a day is enough. Physical activity. It will boost your immune system. It will relaxes your mind and body. When your cells relaxes, you feel great. All right. So well-balanced nutrition, adequate water intake, physical fitness, as what I've said, exercise, and lifestyle modifications, and most importantly for us who are working, increasing the possibility of having symptoms of metabolic syndromes, and not just that, you might have cancer as well. All right. Next, please. Okay, so I said some people ask, why does stress? Link the dots. All right, I want you to link the dots. When you are stressed, some people when they are stressed, they makan, isn't it? They eat and eat and eat when they are stressed. It can lead to what? Obesity. Now, how can obesity lead to cancer? I already explained earlier. When you are obese, you produce a hormone called leptin in your fat cells. This leptin can lead to proliferations of abnormal cells that can lead to mutations of DNA. This mutated DNA can lead to cancer growth. Therefore, that is the linkage of obesity to cancer. Okay, so what to eat? You can see there, you go for organic food, meaning that those food, mana ada lagi, can we still find organic food? Organic meaning that there's no artificial flavoring. There's no chemicals, because chemicals from this processed food, ready-to-eat food, isn't it? Ada Maggi, Indomie, you letak aja apa tuh? Hot water, dah boleh makan. But my dear, you are actually eating chemicals, which is carcinogens present in that food. What is carcinogens? Carcinogens are substances found in this process, ready-to-eat food that can cause cancer. So you have to be very careful. You must eat a lot of fruits that can boost your immune system cells, all right, and to prevent cancers. Right, next. Hey, next, please. Okay, what to avoid? Sorry, yeah. What to avoid? Oh, sorry. The previous slide, sorry.
Slide sebelumnya, Dek.
Previous slide, previous.
Sebelumnya lagi.
Sebelum. Alright, sebelum lagi. Yeah, alright. What to avoid? So you avoid, as what I've said, I already said earlier, foods made hard flour and sugar, especially bread and sweet bakery products. Why? It can lead to obesity, right? Those foods that can lead to obesity, those foods that can increase your glucose in your body, all right, please avoid that. Okay, next. Okay, next. Okay, so preventive gynecology. So women's health matters because women's, excuse me, sebelum, cepat sangat. All right, essential screening test is very important. Even if you don't have the symptoms, but you have a family history of cancer, please go and screen. Okay, go for a screening test for possible DNA of mutated DNA, BRCA1, BRCA2. Okay, they call it cancer markers. Okay, every woman needs it. Okay, next please. Okay, so self examination. If you found any abnormal growth and abnormality in your breast, when you go to the cermin, to the mirror, and go like this, and you have to observe your breast. Is there any difference? Something different in the appearance of my breast. So you have to palpate. So these are the steps on how you should palpitate. Palpate your breast to find any abnormal growth inside. A lump, if you have a lump, even just a simple lump, a small lump, go and consult your doctor. Okay, so that it can be diagnosed early if it is cancer. Okay, next please. So breast cancer, you go for mammography, you go for, the doctor will do the ultrasound. When you go to the doctor, mesti they akan suruh you buat ni, yeah? They will ask you to do this. So say next, please. Okay, so cervical cancer screening, an ounce of prevention is worth a pound of cure. Okay, next, please. Okay, pap smear, especially those who are married. Okay, or even not married, we have to do a pap smear. The cells are taken from the cervix region by a speculum. Okay, this is how the doctor do. Okay, and it will be tested for any presence of cancer cell. Okay, and it is recommended in every 3 years to all female, which is aged more than 30 and above. More than 30 and above, I'm already recommended to do a pap smear, okay, to detect any presence of cancer cell in the cervix to prevent cervical or early detection of cervical cancer. Next, please. So cervical cancer observed for the following signs, okay, chronic pain, any abdominal distensions, loss of weight continuously, heavy prolonged bleeding, okay, in your vagina, of course, not in the bleeding in other parts of the body, before or during menopausal age. So about 48 and above, when you are not yet menopause. Post-menopausal bleeding, if you are already menopause, but you have bleeding. Okay, tiba-tiba, suddenly, you have bleeding. So consult the doctor. That is abnormal already. You found a cervical polyp. Okay, there is a cervical polyp during examinations by the doctor. Not you found, the doctor found it. Okay, tumor during or before menopausal age. All right, next, please. So is it possible to get protection against cervical cancer? Of course, yes. There is a vaccine to this, especially HPV next, which is the main cause of cervical cancer. Next, please. This is the primary prevention from cervical cancer, the HPV vaccine, and it is available worldwide. I don't know in Indonesia if it is available there. Gardasil and Cervarix, these two HPV
Yes.
vaccines available, right? Okay.
Yes,
So
available in English.
yes, for Gardasil, it is has 6, 11, 16, and 18. And then also the Cervarix vaccines, yeah? So please have this. All right, next, please. Because Indonesia has a higher percentage. HPV vaccines made by recombinant DNA technology. Okay, next. I'm just showing you is one who produced this one. So indication for Gardasil, if you have any symptoms, if you have family history of cancer, please go for HPV vaccines. Okay, next, please. Next. Okay, the effectiveness of Gardasil, it is found that Gardasil vaccines efficacy is about 98 to 100% protection against cancer growth, right? Cervarix vaccines efficacy is about 92 to 94%, meaning that Gardasil is still the best, okay, to curb or to prevent or to protect you from cervical cancer. Okay, next, please. So when we can give this vaccine can be given to any girl about 9 years and above, but it is highly recommended for women, of course, 9 to 45 years old. Why does 9 years old should have HPV vaccine, especially if the mother has a history of cancer, right? The most effective time to vaccinate girls and young women is before they become sexually active, meaning before puberty, before they become, they have this first period. Okay, next, please. How many doses recommended? So everybody knows here there are 3 doses, right? So first dose, second dose is after 2 months, the third dose is after 6 months. Next, please. So these are the side effects. Actually, there's no known side effects, which is very serious, but only there is common and erythema, redness of the skin, pain, and swelling. Sometimes pruritus also. Okay, but not so serious. Okay, next, please. So this cannot be given to pregnant women, also lactating mothers, right? Lepas lactating to baby na basta, baru lang boleh. All right, next. So is it developing use everywhere? Yes, it is used everywhere worldwide. Okay, please, next. So the vaccine that has reached millions of people in 106 countries, now increasing actually, can now make a difference in your life by protecting you from cancer. Next, please. Sorry. So let's fight against cancer. Let's join hands together, all the healthcare professionals, how to manage when management ay talata sini because the slides will be ni, but prevention and management actually can be merged together. When the patient having already cancer, what they should do, of course, one of the treatment given by the doctor for the early detection, radiation therapy that will that target cancer cell and destroy it, and chemotherapy that kills cancer cell and slow down the growth of cancer cell, and also medications, drugs that can boost the immune system of the patient, and other drugs, okay, that for pain. So those are the medications, and of course supporting supportive care like a family support, friends, and counseling, okay, where a group counseling where they can exchange, they can share their experiences just to boost their self esteem and to reduce the anxiety level. and family support, and especially emotional support, is very, very important. All right, so let's join hands together. Let's spread awareness about this and take preventive measures by screening yourselves and update yourself every now and then. And of course, take care of yourself. Please exercise, control your diet. All right, in order for you to prevent from metabolic syndromes and eventually cancer. All right, next, please. And that's all for my presentation. Thank you so much for giving me time to share with you some insights on the management, prevention and management of cancer, especially in women, and the updates on the incident cases, especially in Indonesia. You are actually increasing in, I remember in 2020, the incidence of cancer is only about 200,000, 300,000. Now is increasing, as you can see in the graph. Okay, so what you're gonna do about this? Maybe you can you can start proposing a research on why is the incidence rate of cancer in your country is increasing. In the Southeast Asian nations, you are the winner. Okay, so there should be something to be done here. All right, so thank you so much for having me. If there are any questions, please, moderator.
Okay, well, thank you so much, Dr. Filma. The committee, please step share screen. Okay. Okay, thank you so much, Dr. Filma, for such an insightful and very informative presentations. The updates you have shared on cancer prevention and management are valuable, and I'm sure everyone here has learned a great deal today. Okay, now we would like to open the floor for questions. Please feel free to all the participants to raise your hands or type your question in the chat, and we will address them one by one. Maybe there's any question from the participant? Okay, I will check the chat box. Yes. Dr. Filma, we have questions on the chat box. I will read it for you. The first
Okay.
question is coming from Pikayumi. Pikayumi, the question is, does everyone who contracts HPV have the potential to develop breast cancer? Thank you.
Breast cancer.
Yes.
Has
Yes,
everyone with having HPV develop a cancer? Yes, because HPV is the one of the causative factor for the patient to have a cancer. Therefore, that's why it is very advisable to have vaccines. Okay. Everywhere in the world, when they have infected with HPV, there's always a tendency, a trend of increasing the possibility of percentage rate to have cancer.
Okay, so this is a kind of have a risk if someone get
Yes.
contact with the HPV.
Yes.
So
The
it's
risk
really
is very
important.
high. The risk is
Yes.
very high.
So it is really important to have and get the vaccination to prevent the cancer. Okay, thank you, Dr. Filma. I hope Pikayumi can accept the answer. Now we go to the next questions coming from Ibu Wayan Armini. Ibu Wayan Armini, she is lecturer in Literacy Department. Or maybe Ibu Armini want to directly ask you the question so we can speak together here. Okay,
Yeah.
please, Bu Armini.
Okay, thank you, Mrs. Dwi. Yeah, thank you, Dr. Vijana, for your presentation. Yeah, my question. Now there are many new cases of cancer, especially in women cancer. We do dieting enough, exercise enough, drinking water enough, but we a bit quite difficult for the avoiding stress. Okay.
Difficult for you to avoid stress.
Maybe you can share about how we avoid for the stress, and is there a first examination for do to detect for the primary detect for all cancer is there in our bodies.
All right. Okay. Thank you so much, Wayan.
Yes,
Wayan. All right. Thank
Wayan,
you so much,
Wayan.
Mayan. Okay, for your question, the first question is for me to share how to actually manage stress. This is very, very important. You know, everywhere, wherever you go, wherever you work, stress is always be our twin. Because the moment, especially when you are working under pressure, meeting the deadlines here, deadlines there, I myself becoming more stressed. Now, when we are stressed because our hormones will increase, our mental state also will be chaotic, and we are very irritable. Now, for me, for myself, I can only share my experience. How am I going to how I manage my stress? Whatever I can do today, I will not force myself. As long as I will try my best to beat the deadline, and whatever I can do, that's it for today. Now, I will go for, when I go back home, I will leave everything. And when I go back home, I try to relax myself, and I watch movie in the honey, or I try to sing along karaoke, or sometimes I go shopping, window shopping saja, go around and around just to relax my mind. Okay.
Yeah.
Now the next question actually is management of stress is depends on the individual efforts on how you're going to make yourself happy. Okay, so that leave everything at work and enjoy life. Right now, the next question was: is there any test to detect any cancer? Yes. You can go for, I myself, I did that, and the doctor was very surprised. Why did you do that? You really did the cancer marker test? Because I have a gastritis, and my gastritis keeps going on and on. So I was afraid to have gastric cancer, and therefore I go for cancer screening markers. There are cancer screening markers in a specific part of the body. When you go to the laboratory and you ask the doctor, they know that, and you can do that. Yes, they call it cancer markers. So if you are positive in any cancer markers on a specific part of the body, then you have to undergo more test. You might have any cancers in any part of the body, because nowadays, as you can observe, the more progressive we are, the more transformative and well developed we are, the more diseases are coming, new diseases are detected. So I think it's out of questions for God's will. I still believe on that. Okay, so did I answer your question, Wayan Armini?
Yes, thank you, Dr. Pijana.
Okay, welcome.
Okay.
Yeah, thank you, Dr. Pijana, for your answer. So that's it's really need to reduce our stress, whatever our activity, whatever how crowded we are today. So it's just important. Maybe Bu Armini can go shopping in this afternoon with me.
Yes.
We go around, not
You don't
buying
need to buy
something, but
anything. You just
only
go
only window shopping.
window shopping. Yeah.
Yes, only window shopping.
Thank you.
Or watch movie with a friend, or go for karaoke, whatever you like.
Okay,
Yeah,
maybe.
Bu Armini is a great singer. Maybe she will sing one of the song on this afternoon to reduce the stress.
Oh,
Okay, thank you, Bu Armini. Thank you, Dr. Filma, for the answer. Okay, to other participant, maybe still have question because we still have times. Dr. Filma has time for us, so this is very good times to give the questions about the management of the cancer. Okay, we got one new question from Ibu Dwi Purnamayanti. Ibu Dwi, maybe you want to directly asking Dr. Filma? Okay, maybe a little bit busy. I will read the question, Dr. Filma, from Ibu Dwi Purnamayanti, one of lecturer here. In Indonesia, the use of sanitary pads is more common than tampons. Is there a connection between using sanitary pads and cancer, or any component in sanitary pad with cancer? Okay, Dr. Filma.
Wait,
Okay.
wait, sorry, emergency.
Yes, we wait. Okay, to all participants, while we're waiting, our speaker, you can raise your hand, or maybe you can write your question.
Sorry. That was my nephew actually. Okay, what was the question again?
Okay, I read once the question from Ibu Dwi Purnamayanti. Dr. Filma, in Indonesia, the use of sanitary pads, it's more common than we use the tampons. Is there any connection between using sanitary pads and the cancer, or any component in sanitary pads have the correlation with the cancer?
Okay. There are studies on this, no research studies on this, whereby sanitary pads contains actually substances or chemicals that somehow can link to cancer, but the 100% facts on this has not been yet proven, but there is scientific research on this, that there is a linkage, there is an associations. When you go to the components of the sanitary pads having the substance called, is not toxin, dioxin, if I'm not mistaken, is a substance called dioxin, whereby it can cause cancer. Why? Because these substances can kill normal cells and can cause mutations in the cell. Yes, you are right. That's why I think there is, therefore, as what I've said earlier, Indonesia, all of you need to do a research on this. The factors why cancers in women, especially breast cervical cancers, are high, highest in Southeast Asia. So according to the research, there should be a perception there that, oh, maybe using sanitary pads, that is one of the components of going to find out facts about it. Since there are research connecting this substance in sanitary pads, which is the so-called, there are other chemicals aside from dioxins, I forgot the name. Okay, aside from that, but there are chemicals, dioxins and others, that can cause actually associated actually with cancer growth. Okay.
Yes, thank you,
I
Dr.
answered
Filma,
the
for
question.
your answer. Yes, I hope this answer Ibu Dwi Purnamayanti questions. I think this is the answer, because we still need to make attention with the component of the sanitary pads. That's why maybe it's really
Yes.
important to take note the expired date of the sanitary pads, not use if it is expiring. Okay, thank you, Dr. Filma.
Yes, I forgot.
Other question maybe from the participants? We still open maybe one or two questions again. One or two question more maybe. Okay, while we're waiting, Dr. Filma, maybe I have a question for you, talking about the vaccinations of our cervical cancer, that we got an immunization and vaccination for not to going to have the disease. Maybe for your experiences, because our participant is many of the students, to maybe they little bit want to know how effective the vaccination to prevent the cervical cancer on your experiences.
cervical cancer, the vaccinations
Yes,
for
the
SPB.
vaccination.
All right.
Yes.
SPB was produced. This is to enhance the protections because it will enhance your DNA, not to fight the infections of SPB. Now, when you have the SPB vaccine, meaning you are immune to the SPB virus, and therefore you are protected from SPB causing a cervical cancer. But I cannot guarantee whether there is other factors that can also cause you cervical cancer. But most of the studies, cervical cancer is usually, especially SPB, caused by SPB. Now, if you have a vaccine of SPB, inshallah, cervical cancer. All right. The rest of that is not in our hands. It's God's will. I cannot say, oh, you cannot have cancer. If God give you cancer, I cannot do anything, or any doctors cannot do anything, isn't it? But we are only talking about a scientific research, the facts that HPV vaccines can actually, remember that the efficacy, meaning the effectiveness of HPV protection against cervical cancer is 95 to 100%. Okay, so take it from that. All right.
Yes, it's better to get the vaccination. Yeah, Dr. Filma, thank you for your answer. We get any questions on the chat box? I will read it for you. The question is coming from Cinta Kalista. The question is, if there is a family history of the cancer, can we prevent the cancer by changing our lifestyle to be healthier? Or is there still a possibility of getting cancer?
Okay. When you have a family history, you go for screening, you have to change your lifestyle, meaning that you have to be very careful because the word risk is already with you. You are at risk, higher risk to get the cancer. So try your best. We try your best to modify your lifestyle, to exercise, to eat a healthy foods, and somehow it can increase because there are research suggested that when you do this, your possibility, the risk that you can have cancer, although you have the risk factor, is less because you were able to at least modify the lifestyle, your activities. But somehow there are cases where people will say, hey, Dr. Bima, kenapa pula? Why there are still my friend jogging, modifying the diet, or eating healthy food, but still got cancer? And that one I cannot answer you because, as what I've said, it's God's will. Okay, so but there is a but to that. That's why there is a research in order for us also to have the prevention on things that can harm our body. Okay, please, you tried your best, lifestyle modifications and all that, because the word risk is already with you, meaning you are really at risk. I still saw one question there that is there any actually causes specific
causes
for
cancer.
cancer.
Yes.
I have mentioned earlier, there is no specific cause. If we were able to identify the specific cause of cancer, the treatment will be very easy. But there is no specific cause. There is no identifications of a specific cause of cancer. There is only risk factors. Because according to the study, these are the risk factors: obesity, stress, chronic illnesses, infections. Because people who have cancers, when they do a research study, they have found out that most of these people are having infected with SPB, for example. The higher percentage of patients infected with SPB has also the higher percentage getting cancer. Therefore, they publish that SPB infection are one of the risk factors of a cancer growth. But there's no specific causes, because, my dear, if we can identify specifically what causes cancer, very, very easy to treat it. All right? There's no specific.
Yes. Okay. Thank you, Dr. Filma. That's also answering the question from Novi, who asking about the actually cases specific for the cancer. So there is no specific cases, but there is a risk factor, and then we can prevent the risk factor with the healthy lifestyle, management stress, and so on and so forth. Okay, thank you. Okay, for the last question, maybe if there are any one questions more, we can accept before we closing the presentation, the session. Okay, Dr. Filma, I think there is no questions more. Maybe before we closing this session, I would like to asking you maybe to give a kind of tips for our young generation, as you told before that Indonesian cases of the cancer in Indonesia increasing over by year. So maybe because we know that the lifestyle of the young generation today is very different with us before. In over 1 decade, it's very different. While the today young generation is very high tech, everything's high tech, and everything I see is more simple than before. One tips or some tips for young generation, please, Dr. Filma.
Okay, thank you so much, Dwi. Can I call you Dwi? Dwi Mahayati.
Yes, Dwi.
Thank you so much. Okay, my 2 cents of advice to the younger generations is that please have enough sleep, especially at night, because always having a lack of sleep, especially at night, can damage your cells. Not just even your cognitive abilities will be reduced. All right. And the advent, as what I've said, the coming of technologies, of digital technologies and all that, causes so many diseases among younger generations. Why? Because of sleepless nights, in the mobile phone until 2 o'clock, until 3 o'clock, and that is happening everywhere. All right, even my nephews and nieces are doing that. And so please, my advice is to please have enough sleep, because if you deprive your body of having a good night's sleep, having enough, at least 6 to 8 hours, you are depriving your cells of a healthy process, healthy metabolism. Okay, because we have the so-called cell metabolism, and the cell needs to rest as well. When the cell is at rest, your liver stops to detoxify. Everything that is in our body will be detoxified by our liver. Now, at 10 or 11 o'clock, as what the scientific research suggested, our liver stops to detoxify because the cells need to rest. When you don't have rest, there are so many diseases that you can get. You can get CNS disorders, you can get even cancer, because it will lead to high risk of increased sugar when you don't sleep at night, okay? And reduce fluid in your body that can somehow be connected to chronic diseases and cancer. So please sleep early, have exercise, do not just sit there and mind with your phone, all right? Have exercise at least 30 minutes a day. You don't need to have a vigorous exercise. Walking very fast also for 30 minutes, as long as you sweat, you are already excreting toxic substances in your body. So at least 30 minutes a day, all right? You will have 5 days a week. 5 days, 30 minutes a day. You have already 150 minutes recommended by WHO, at least 150 minutes per week exercise. All right, even a brisk walking, very fast walking exercise is already tak payah run. All right, so at least 30 minutes a day. It will boost your immune system cells relaxes your body and relaxes your mind, because when your body is relaxes, all of the cells of the body relaxes, and therefore it helps you to protect you from all the diseases, including cancer. So that's all I can advise to younger generations. And eat a healthy diet. Jangan always ice cream. High fat diets is not good. You will not just get cardiac disease or metabolic syndromes. Okay, you can get cancer as well. So no wonder cancer is increasing. All right. So that's my 2 cents of advice. Thank you so much.
Yeah, thank you so much, Dr. Filma, for your advice to our young generation. Okay, to all, maybe before we closing this session, I would like to read some take-home messages from our session today. The presentation by Dr. Filma Jurusan provided a comprehensive update on the prevention and management of cancer in women. So the key points include: cancer is responsible for the death of 4 million women annually worldwide. So this is really important to know about this fact. And then the common risk factor include tobacco use, unhealthy lifestyle, infections, organisms, and genetic predispositions. Human papillomavirus is a major cause of the cervical cancer, and preventive measures such as HPV vaccinations and screening programs, example pap smear and mammograms, play a crucial role in early detection. So it is really important to do. And next, primary prevention focus on lifestyle changes and vaccination, while the secondary prevention involves regular screenings. The tertiary prevention includes comprehensive treatments, option, and palliative care. A balanced diet, a regular exercise, and stress management are very essential for overall wellness and cancer prevention. And the last is it's very essential for women to take charge of their health by participating in preventive programs and adopting healthy lifestyles to reduce their cancer risk. Okay, that's all for the presentation and session from Dr. Filma. We would like give the thank you so much to Dr. Filma Jurusan for your excellent presentation, your insightful information today with us. Thank you, Dr. Filma, and for all the participants. I'm sorry if there was any inconvenience, if there are any problems or something mistake in this session. We are really sorry for that. I hope this information bring benefit to all of you. Thank you so much. I'm doing Mahayati closing this session and the time given back to the MC. Thank you, Dr. Filman.
Thank you, Dewi Mahayati. Thank you so much for having me. Thank you.
Thank you. MC, the committee, please.
Okay, thank you to Mrs. Vidani Dwi Mahayati as M.Keb, as the moderator who has guided the guest lecture very well. The next event continue with the handover the certificate to the speaker, Mrs. Dr. Filma Jurusan, as today's guest lecture. We invite the head of midwifery department to hand over the certificate to the speaker.
Okay, thank you, Putri Citra. Ibu Dr. Filma, I would like to thank you so much for sharing knowledge today. And as a form of appreciation, we will hand you a certificate as a speaker. Thank you very much, Ibu Dr. Filma.
Thank you so much. Thank you so much. Accepted.
Thank you, Ibu.
Okay. Thank you too. What happened?
MC still mute. Oh, sorry, MC still mute.
The event continue with the handover the certificate to the moderator, Mrs. Bidani Madevi Mahayati as S.Tr. As today's guest lectures, we invite the head of midwifery department to hand over the certificate to the moderator.
Ya, terima kasih Ibu Dwi sudah menjadi moderator yang sangat hebat pada pagi hari ini. Saya berikan sertifikat sebagai moderator yang sangat luar biasa. Terima kasih.
Terima kasih, Bu. Sama-sama. Terima kasih.
Now we are going to the communication session. Without reducing our respect, we invite the speaker, guests, and participants to attend via Zoom meeting to turn on the camera because a documentation session will be held. I will guide the documentation session from slide 1. Okay. 1, 2, 3. Okay, the next slide 2. One, two, three. Okay, the next slide 3. 1, 2, 3. Slide 4. 1, 2, 3. Slide 5. 1, 2, 3. Slide 8. Okay, sorry, slide 6. 1, 2, 3. Slide 7. 1, 2, 3. Slide 8. 1, 2, 3. Slide 9. 1, 2, 3. Okay, thank you. Well, our respected audience, this is the series of guest lectures today. Hopefully, what we get at this event can benefit to all of us. I would like to thank you, the invite guests and participants of the guest lecture who have participated in activity from beginning to end. Before we close today's events, all participants are requested to fill in the evaluation link, which will be sent by commit in the Zoom chat and YouTube live streaming columns. The evaluation link can be accessed in 10 minutes until 10:52 o'clock.
Replace all the blanket over the chest and abdomen. Now, what you're supposed to do, once you already clean up nicely, okay, then only you cover at the upper part and then you go at the lower area, at the genital area part, okay? You have to clean up nicely at the groin area, okay? You clean up and make sure, okay? Make sure all patients feel comfortable, okay? If a patient
I am Putri Chitra, as the Master of Ceremony representing all the commits on duty, would like to thank you for your participation and support, and we apologize if something you didn't like. Finally, I close with Paramasanti. Santi, Santi, Santi Om. Wassalamualaikum warahmatullahi wabarakatuh. Shalom Nama Budaya. Good morning. Have a great day. Thank you and see you at the upcoming activity.